Turns out, understanding underinvestment in prevention. You know what the weirdest part about staying healthy is? We're terrible at it, even when it's completely free, even when it could literally save your life, even when we know exactly what we need to do. We just don't do it. We skip the checkup. We miss the vaccine. We stop the exercise routine by week 3. And the worst part, we're not lazy or stupid. We're just broken in a way that science is only now starting to understand. So what exactly breaks inside your brain when free healthcare is sitting right there waiting for you? Before we answer that, let's back up. For decades, public health experts have been convinced they knew why people don't invest in prevention. They figured it was a money problem, or maybe an access problem. Build better clinics, lower the prices, remove the barriers, and people will show up and stay engaged. That made sense. That felt logical. But here's where it gets uncomfortable. It hasn't really worked. We've made prevention cheaper and easier and more available than ever before, and people still don't do it, still don't stick with it. Something else is going on inside our heads. That's where Mohammed Jamali and Hamid Voghouei came in. They're researchers at Kaiser University in Florida. The study was published in the Journal of Preventive Medicine in 2026. And what they did was take apart the behavioral economics of prevention, how our brains actually make these decisions, and they found something that reframes the whole problem. Here's the thing about how they approached this. They didn't run a traditional experiment with subjects in a lab. Instead, they built a conceptual framework. Think of it like building a diagnostic tool. They looked at decades of prevention research, all the programs that worked better than expected, and all the ones that flopped despite being brilliant on paper. And they asked a different question. What if this isn't actually a financial problem? What if it's a problem with how our brains budget time, effort, and psychological comfort? They pulled 2 mechanisms from behavioral economics to build their model. First, present bias. That's the tendency to value right now way more than later. And second, mental accounting. That's how we psychologically organize and evaluate costs. Then they asked, what happens if both of these are running at the same time? The framework they built is surprisingly simple and surprisingly powerful. It says there are 2 moments where prevention fails. First, you have to start. You have to actually show up for that first appointment. Then you have to keep going. You have to maintain the behavior for months or years. And our brains are sabotaging us at both moments using completely different mechanisms. Present bias is the more obvious one. Right now feels heavier than later. Your brain is literally weighted toward today's comfort. So the immediate friction, the time cost, the psychological discomfort, the hassle of finding the clinic, waiting in the office, that all looms much larger than the abstract future benefit. I won't have a heart attack in 5 years feels way less real than I don't want to sit in a waiting room for 2 hours today. Present bias gets stronger when the benefit is abstract or distant, stronger when the immediate cost is concrete and painful. And prevention is basically the worst-case scenario for present bias. The cost is always immediate. The benefit is always somewhere off in the future. But here's where it gets darker. Even when you overcome present bias once and start the preventive behavior, you still have to fight mental accounting. This is how your brain categorizes costs. And here's the thing. When you think about prevention costs, your brain doesn't organize them the way economists do. A free vaccine still feels expensive to your mental accounting because you're paying time. You're paying the psychological discomfort of a needle. You're paying attention and effort. Your brain lumps all of those together in one cost category. And suddenly that free intervention doesn't feel free anymore. It feels like you're paying for it in ways your brain finds difficult to justify. What Jamali and Voghouei showed is that this isn't a bug in human decision-making. It's the actual mechanism. And it explains something that should have confused prevention experts years ago. Why do some programs increase enrollment but fail to maintain participation? Because the barriers are actually different. Overcoming the mental accounting for initiation is different from sustaining the behavior when present bias is working against you every single day. You can throw resources at the enrollment problem and succeed, but that doesn't touch the persistence problem. Now let's connect this to your life. You know that colonoscopy you've been putting off? Present bias. Your brain is saying the discomfort of the procedure is more real than the cancer prevention benefit. But there's something else happening too. Mental accounting. You might be able to afford the time and the money, but is your brain categorizing this as worth the total cost? The appointment setting calls, the scheduling hassle, the day off work, the awkwardness. Your brain might be saying, I could use that mental energy for something that feels more immediately important. And that's not illogical. That's your brain doing exactly what it evolved to do. Prioritize today. Protect today. Resist effort today. The limitation here is that this is a framework paper, not a massive experimental study with thousands of subjects. It's a conceptual tool. It doesn't prove that present bias and mental accounting are the only reasons people skip prevention. And it doesn't quantify exactly how much each mechanism contributes to underinvestment. But what it does is explain why so many well-designed programs have gotten stuck on the persistence problem. What's particularly interesting is how this sits against previous prevention research. For years, the field has been treating prevention as a monolithic problem. One barrier, one solution. Make it free, make it available. And people will maintain healthy behavior. But this framework says that's backwards. The problem is dual. You need different interventions for uptake versus adherence. You might need to reduce friction and lower psychological barriers for initiation. But you need something completely different for sustained behavior. You might need to restructure how people account for costs, or find ways to make future benefits feel more real and present. Here's what really stands out from this research. It raises a question that nobody seems to have asked clearly before. If individual-level decision-making is broken in this specific way, can you just throw better policy at it? Or do you need to actually address how people's brains categorize and value prevention? That's not a rhetorical question, and it's going to matter more over the next decade as prevention becomes increasingly central to healthcare. Because telling people what to do clearly isn't enough. We need to understand why their brains resist it, and why they stop doing it even when they start. Here's the thing that should be keeping you up at night. We're probably underinvesting in prevention, not because we're broken or lazy. We're underinvesting because our brains evolved to solve today's problems first. Prevention is asking our brains to do something they're fundamentally built to resist. And until we address that, until we stop treating this as a policy problem and start treating it as a neurobehavioral problem, we're going to keep building programs that work great on day 1 and fail on day 90. Turns out, scientists have been busy, and they're not done yet.